Have you ever wondered what really happens inside your body after taking Tadalafil for one whole month? Most people think it's just about stronger erections. But what if I told you that the effects go far beyond the bedroom? Here's something shocking. Over 300 million men worldwide suffer from erectile dysfunction, and prescriptions of Tadalafil have skyrocketed in the last decade. But very few actually understand what this little pill is silently doing to their circulation, their heart, and even their overall health. And here's the real catch. After 30 days, some changes can be surprisingly beneficial, while others, if ignored, could put your health at serious risk. Stay with me until later in this video, because I'll reveal a surprising effect of Tadalafil that even many doctors don't discuss openly. It might completely change the way you look at this medication. But first, let's break down how Tadalafil works inside your body. Tadalafil belongs to a class of medications called PDE5 inhibitors. But what does that really mean in simple terms? Think of your blood vessels as flexible pipes. Normally, when you're aroused, your body releases a chemical messenger called nitric oxide. This messenger relaxes those pipes, allowing blood to flow more easily into the penis and create an erection. Here's the problem. Another enzyme, PDE5, acts like a stop signal, breaking down that messenger too quickly. For many men, this means the erection fades before it should, and this is where Tadalafil steps in. It blocks PDE5, which keeps the chemical messenger active for longer. The result? Improved blood flow and stronger, longer-lasting erections. But here's something most people don't realize. Tadalafil doesn't only act in the penis. PDE5 is also present in other parts of the body, like the lungs, blood vessels, and even smooth muscles. That's why some patients taking Tadalafil for erectile dysfunction notice unexpected benefits, such as easier breathing, improved circulation, and even lower blood pressure. Quick curiosity. Unlike other ED medications that last 4-6 hours, Tadalafil has earned the nickname the weekend pill because its effects can last up to 36 hours. But what actually happens in the first hours and days after you start taking Tadalafil? That's where things get interesting and maybe a little surprising. So, what actually happens the very first time you take Tadalafil? Within about 30 to 60 minutes, the medication begins to circulate in your bloodstream. You might not feel anything right away because Tadalafil doesn't create an erection by itself. Instead, it makes it easier for your body to respond naturally to arousal. For many men, the first dose already brings noticeable differences. Erections become firmer and easier to maintain. The performance anxiety decreases simply because confidence increases. Some even report a subtle improvement in mood because blood vessels are relaxing and circulation improves. But not all early effects are positive. In the first days, some people experience headaches because of blood vessel dilation, flushing, or a warm sensation in the face, a stuffy nose, or mild back pain. These effects are usually temporary as the body adapts. Here's a surprising fact. Because Tadalafil improves blood flow, researchers have been studying it as a possible therapy for conditions like pulmonary hypertension, a serious problem with high pressure in the lungs. But here's the real question. What happens when you keep taking it regularly? Day after day. That's when the body starts showing deeper adaptations, especially during the first week. During the first week of consistent Tadalafil use, your body begins to adjust to the new routine. This is the stage where small but noticeable changes start to appear. For many men, erections become more predictable and reliable. The anxiety of, "Will it work this time?" starts to fade, replaced by confidence. Psychologically, that shift alone can have a huge impact, not just in the bedroom, but in overall self-esteem. At the same time, your blood vessels are getting used to staying more relaxed. This can improve circulation not only in the pelvic area, but throughout the body. Some people notice less fatigue during physical activity, a slight reduction in blood pressure, even an unexpected improvement in sleep because the body is working more efficiently. Of course, not everything is smooth. The first week is also when side effects are most common. Headaches, nasal congestion, indigestion, or muscle aches can show up. For most, these symptoms gradually decrease as the body adapts. Here's a curious detail. Some studies suggest that by the end of the first week, men who take Tadalafil daily may already notice better morning erections, a strong sign of improved vascular health. But what happens when you continue into the second and third weeks? That's when the benefits often move beyond just erections and start affecting your overall circulation and performance. By the second and third weeks of consistent Tadalafil use, the effects start going beyond erections. Why? Because the medication continues to keep your blood vessels more relaxed and flexible. This leads to a series of circulatory improvements. Many men report better stamina during daily activities, climbing stairs, walking, even exercising. Blood pressure may stabilize, especially in those with mild hypertension. Some notice reduced leg cramps or heaviness because circulation is more efficient. Sexual performance also becomes more natural. Instead of waiting for the pill to kick in, many describe a sense of readiness at any time, one of the unique advantages of Tadalafil compared to shorter-acting medications. And here's something that often surprises patients. Improved circulation isn't just about sexual health. A healthier vascular system can mean better oxygen delivery to muscles, quicker recovery after exercise, and even potential support for heart health. Fun fact, in clinical studies, men taking Tadalafil daily not only improved erectile function, but some also showed better mood scores. Scientists believe this is partly due to the combination of confidence, performance, and improved blood flow to the brain. But the real question remains, what happens when you reach a full month of use? That's where the maximum benefits often become clear, and where many hidden effects finally show themselves. After a full month of taking Tadalafil consistently, most men notice the peak of benefits. By this stage, the body is fully adapted, side effects, if they appeared, are usually minimal, and the positive changes become more stable. The main transformation is, of course, in sexual performance. Erections are not only stronger, but also more reliable, regardless of stress or fatigue. Many couples report that intimacy feels more spontaneous again, restoring confidence in the relationship. For men who once avoided sexual activity out of fear of failure, this confidence can feel life-changing. But beyond the bedroom, the systemic benefits are where Tadalafil really surprises people. Vascular health improves thanks to constant support for blood flow. Some men with mild hypertension or circulatory issues experience a noticeable difference in daily well-being. Increased blood supply may also support muscle recovery and even endurance in physical activity. By this point, some researchers believe Tadalafil might serve as more than just a sexual health drug. It may actually contribute to long-term cardiovascular protection. While studies are ongoing, the potential is promising. Here's a powerful point. Many men describe not just physical benefits, but also emotional ones. Confidence, reduced anxiety, and restored intimacy all combine to create a profound psychological boost after 1 month. But hold on, there's another side of the story. Along with these benefits, there are common mistakes and risks that men make when using Tadalafil, and ignoring them could lead to serious problems. That's exactly what we'll uncover in the next chapter. By now, it's clear that Tadalafil can bring remarkable benefits after 1 month. But here's the truth. Many men use it the wrong way, and that can turn a helpful medication into a dangerous one. Some of the most common mistakes include taking it without medical guidance. Many men buy Tadalafil online or from unregulated sources. Without proper medical supervision, they risk dangerous interactions with other medications, especially nitrates, which can cause a sudden and life-threatening drop in blood pressure, using higher doses than prescribed. Some think more pill, more effect, but that often just increases side effects, like headaches, muscle pain, and even vision changes, without offering any extra benefit. Mixing it with alcohol. Tadalafil plus heavy drinking can lead to dizziness, fainting, or reduced effectiveness, ignoring underlying health issues. Erectile dysfunction is often a warning sign of cardiovascular disease. Masking the symptom with Tadalafil without checking heart health can delay diagnosis of a much bigger problem. Here's a sobering fact. Studies show that men with untreated heart disease who use PDE5 inhibitors unsafely may double their risk of cardiac complications. But when used correctly under medical supervision, Tadalafil can be not only safe, but also surprisingly beneficial in ways most people don't expect. And that brings us to the final chapter, the long-term considerations and the hidden benefits that go far beyond sex. Using Tadalafil for just a month can bring impressive changes. But what about long-term use? 3 months, 6 months, or even years? Here's what research and clinical practice reveal. Daily low-dose Tadalafil has been studied not only for erectile dysfunction, but also for benign prostatic hyperplasia, BPH, a common condition where the prostate enlarges and makes urination difficult. Men report easier urination and reduced nighttime bathroom trips. Some evidence suggests long-term vascular benefits, with improved endothelial function, the inner lining of blood vessels, which is directly linked to heart health. For men with diabetes, Tadalafil may even help with better blood flow to tissues, offering a protective effect against complications. Of course, long-term use isn't for everyone. Medical supervision is crucial to monitor blood pressure levels, interactions with other medications, kidney and liver function, since these organs process the drug. But when managed carefully, many men use Tadalafil for years with consistent benefits and minimal side effects. Fascinating note, some researchers are exploring whether PDE5 inhibitors like Tadalafil could play a role in longevity medicine due to their effects on circulation and inflammation. While still early, the idea that a sex pill could also support healthy aging is gaining attention. And this leads us to the final chapter, the part you've been waiting for since the introduction, the hidden effect of Tadalafil after 1 month that many doctors don't openly discuss. Back at the start of this video, I promised to reveal a surprising effect of Tadalafil after 1 month of use, something that most people, and even many doctors, rarely discuss. Here it is. After 30 days of consistent use, Tadalafil may actually act as a form of vascular training for your entire circulatory system. By keeping blood vessels relaxed more often, it doesn't just improve erections. It helps your arteries stay more flexible, reduces vascular stiffness, and may even support long-term cardiovascular resilience. In other words, what began as a performance pill may also work as a heart and blood vessel health booster. And this is crucial because erectile dysfunction is often one of the earliest warning signs of cardiovascular disease. Men who restore circulation with Tadalafil aren't just improving their sex life, they may also be protecting their heart, brain, and overall longevity. Of course, none of this replaces medical care. Tadalafil should never be seen as a miracle pill. It works best as part of a health plan that includes exercise, proper diet, and regular medical checkups. Imagine this. What if, by treating ED early with the right approach, you not only regained confidence in intimacy, but also prevented a future heart attack or stroke? That's the true hidden power of Tadalafil, and why medical supervision is non-negotiable. Now, before we wrap up, let's summarize everything and give you clear, practical takeaways you can apply starting today. So let's recap what we've discovered about Tadalafil after 1 month of use. In the first days, it begins improving blood flow, making erections easier to achieve. By the first week, your body starts adapting, confidence increases, and side effects usually decrease. During weeks 2 and 3, circulation improves more broadly, benefiting not just sexual health but also physical performance. After 1 full month, most men reach the peak of benefits: reliable erections, restored confidence, improved intimacy, and surprising systemic effects. But we also saw that common mistakes like mixing with alcohol, overdosing, or skipping medical guidance can turn benefits into serious risks. And finally, the hidden effect. Tadalafil may support not only sexual performance but also long-term cardiovascular health, an incredible potential benefit when used responsibly. Practical advice: never start Tadalafil without consulting your doctor. If prescribed, follow the exact dose. Combine it with lifestyle changes. Exercise, good nutrition, and regular checkups for the best results. And remember, your sex life is deeply connected to your overall health. Taking care of one often means protecting the other. Now, if you found this video helpful, imagine what else you could discover about protecting your heart and improving your energy. That's why I recommend watching our next video. 7 early signs of heart disease most men ignore. It's the perfect complement to what you learned today. Don't forget to like this video, share it with someone who could benefit, and subscribe so you don't miss our next deep dive into health, longevity, and prevention.